So I actually have not ever seen like an eyebrow be done. Have you seen
Yeah,
that?
and I've actually been in the surgery and did it with Dr. Simmons. Oh, eyebrows are incredible. We take the hair from the back of the ear because that's typically where we see that finer hair at.
Yeah.
And they remove it the same way they would an FUT, where they take a section of tissue out. And then we suture that closed. We take that little section and we individually harvest down to 1 follicular unit grafts.
All one.
All one hairs, yep.
Okay.
And then Dr. Simmons, he typically asks the patients to kind of come in with their evening makeup on, how they like their eyebrows to be drawn on nice and thick. And then he will utilize a surgical pen to kind of mark out that area, and they kind of create that together. Really make sure that we're getting the full thickness. And like we said, we usually like to say, let's go more on surgery day, because you can pluck them out, you can shape them down, whatever you want to do.
Yeah.
And then once he draws those on and we have those one hairs all trimmed down, he uses his angled incision maker and he just makes all the incisions one by one. He starts typically on the inwards and then he works out to the tail.
Yeah.
He'll show the patient what it kind of looks like, that rough drawing, once he gets all those sites inside. And then the clinical team puts those hairs in one by one by one.
That is so cool.
Yeah. Once they're all done, then we show the patient again, and we typically make some little tweaks.
Oh, yeah.
Add a little bit more.
Yeah.
Because they want to be, the best that they can possibly be.
For sure.
And then in about 3 days, they really start to fluff off. And then in about 7 to 10 days, they're pretty much back to where they normally were. And then the hair starts growing in.